Today we will be studying about the Glasgow Coma Scale or the GCS scale, and we will be understanding the GCS scale completely. So what the GCS scale really is and how the patient has scored on the basis of the GCS scale. And at last I'll be giving you a mnemonic to memorize the GCS scale forever. So by the end of this video you will have memorized the GCS scale completely. So please watch the video till the end. The Glasgow Coma Scale was devised in 1974 by two neurosurgeons, first being Professor Sir Graham Tesserdale, who was also the president of the Royal College of Physicians and Surgeons of Glasgow from 2003 to 2006. Glasgow is a city in Scotland where the Royal College of Physicians and Surgeons is situated, and the scale was devised there, so it was given the name Glasgow Coma Scale. The another neurosurgeon is Professor Brand Jennett, who also coined the term vegetative state in 1972. So these two neurosurgeons were responsible for giving the GCS scale. Now the Glasgow Coma Scale is a neurological assessment tool, and it basically aims to determine the severity of a patient's brain dysfunction. So how severe is the brain dysfunction is determined by GCS scale. Also, it is used to assess the level of consciousness in a person. So how conscious is the person following a traumatic brain injury? So following a traumatic brain injury, what is the level of the consciousness of the patient is also determined by the GCS scale. Now the patient assessment will basically result in a score between 3, which is the minimum score that the patient gives no response at all, which has the worst prognosis, and 15, which is the maximum score that the patient is fully alert and responsive, which has the best prognosis. Also, the GCS assessments should preferably be done before any paralyzing or sedating medication is administered or before the patient is intubated, because giving any medication or intubating the patient will basically give a false result or false score. Now here, as I already told you, 3 is the minimum score and 15 is the maximum score, and the GCS scale is divided into 3 categories or 3 responses: the eye response, the verbal response, and the motor response. The eye response has a minimum score of 1 and a maximum score of 4. The verbal response has a minimum score of 1 and a maximum score of 5, and the motor response has a minimum score of 1 and a maximum score of 6. So you can memorize it as eyes has 4, verbal has 5, and motor has 6, 4, 5, 6, right? So if we add up all the maximum scores, 4 is the maximum score of eye response, 5 is the maximum score of verbal response, and 6 is the maximum score of motor response. So if we add up 4, 5, and 6, we'll get 15. So 15 is the maximum score, right? Now let's just understand how we really assess the patient on the basis of the GCS score. Here, as I already told you, the GCS score is divided into 3 categories: the best eye response, the best verbal response, and the best motor response. So let's start with the best eye response. Here we have a patient. So if the patient opens his eyes spontaneously, then he's given a score of E4, that is spontaneous eye opening, right? So if the patient opens the eye on a stimulus, that is the voice or speech. So if you ask him something like hello, and if he responds by opening his eyes, right, so he's given a score of E3, that is eye opening to speech. If the patient, right, opens the eyes when we give a painful stimulus, so we apply a painful stimulus on the patient and he responds by opening his eyes, then he's given a score of E2, that is eye opening to pain, right? And if the patient does not open his eyes at all, so he gives no response, then he's given a score of E1, there is no response at all. Next, we have a verbal response. Now what is the best verbal response? How do you really check the best verbal response is we ask the patient some question and we check the response. We check the verbal response of the patient and give him a score. Like we ask him a question like, where are you? And if he responds correctly, that in the hospital, then he's oriented, right? So he's given a score of V5. He's oriented, that he knows where he is. Next, we ask him again the same question, where are you? And if he responds by saying where am I, so that means he's in a confused state. So he's given a score of V4, that he's giving a confused speech. We ask him again, where are you? And if he responds by saying stupid, right, he's giving an inappropriate response. So he's giving an inappropriate word. So he's getting a score of V3. Inappropriate speech. For giving an inappropriate speech, he's given a score of V3. We ask him again, where are you? And if he responds by saying Aga, then he's giving a very incomprehensible speech, right? So he's giving an incomprehensible sound, so he's given a score of V2. And we ask him again, and this time he's giving no response at all, so he's given a score of V1 for no response. So this is the best verbal response. Now we check the best motor response, right? So first we ask the patient to do something, like, can you lift your left hand please? So we asked him to do something, and if he correctly lifts his left hand, then he's obeying our command, so he's given a score of M6 for obeying our simple command. Next, we give a painful stimulus to the patient, and we check the motor response of the patient in we check the motor response by giving a painful stimulus. So if he responds by localizing the pain, so he localizes where we are giving the painful stimuli, so it is localizes pain, so he localizes pain and is given a score of M5 for localizing the pain. Again, we give a painful stimulus, and this time he's withdrawing his hand, right? He's withdrawing his hand, which is a withdrawal, and which is a normal flexion response, so he gets a score of M4 for withdrawing his hand, which is a normal flexion response. We give him again a painful stimulus, and this time he is responding by showing a abnormal flexion response. His hands are flexed to his center of his body, so this is an abnormal flexion response, which is also known as a stereotyped flexion or a decorticate posture of the patient, and for this he is given a score of M3. We again give the painful stimulus to the patient, and this time he is responding by showing us an abnormal extension response, that his hands are extended, right? And this is known as a stereotyped extension or a decerebrate posture. Now I'll be explaining about decerebrate and decorticate posture in next slide. So for now, let's just understand that M3 is a decorticate posture and M2 is the decerebrate posture. And at last, we give a painful stimulus again, and this time he's not responding at all, so there's no response, so he's given a score of M1. So like this, we are giving we are categorizing, scoring the best eye response from E1 to E4. We are scoring the verbal response from V1 to V5, and we are scoring the motor response from M1 to M6. Now, the total GCS score would be E4, V5, and M6, 4 being the maximum eye response, 5 being the maximum verbal response, and 6 being the maximum motor response. So this is how we really calculate the total GCS score. E4, V5, M6 will equal to 15. So 15 is the maximum GCS score, right? Now here, this is the decorticate and the decerebrate posture. Now decorticate means an abnormal flexion response. Now how do you remember that decorticate is flexion and decerebrate is extension? So here decorticate, so here is a core or core, right? So when the arms are basically flexed to the core of his body, he is flexing his arms to the core of his body, to the center of his body, so it is known as decorticate posture, right? Decorticate or decorticate, that is the arms are to the core of his body, and in decerebrate the arms are not to the core, that is the arms are away from the core of his body, that the arms are in extension. So if decorticate is flexion, then decerebrate is extension. Or we can also remember decerebrate is extension by seeing the number of E's, like there is 1, 2, 3 and 4 E's in decerebrate. That means the arms are an extension, and decorticate is flexion because the arms are to the core of his body. In the next video, I'll be explaining about the decorticate and decerebrate posture in detail, and how or what lesions in the brain will cause the decorticate and decerebrate posture. So for now, let's just understand that decorticate is an abnormal flexion response and decerebrate is an abnormal extension response of the hands. So now let's just get to the mnemonic that we all are waiting for. Now let's start with the mnemonic. So the first was the eye response, right? So the eye response, so the mnemonic for eye response would be eyes itself. So eyes itself is the mnemonic. So let's write it E, Y, E and S. So for first E, it is eyes are shut. So it means eyes are shut, that means no response. right? Eyes are shut means no response. We are grading it from 1 to 4 serially. So 1 is E, Y is 2, E is 3, and S is 4. For E is eyes are shut, there is no response, that means 1, score of 1. Y, for Y let's just assume a Y-shaped stick. So Y-shaped stick is used to prick. So it is used to prick the eyes of the patient. So let's just assume the Y-shaped stick is used to prick the eyes of the patient. That means the patient is responding to pricking or responding to pain, right? So responding to pain means the score of 2. For E, let's just assume is ear. Ear means sound, right? So the patient is responding to sound, so he gets a score of 3. And for S, it means spontaneously. So if he opens the eyes spontaneously, he gets a score of 4, right? So 1 means eyes are shut, 2 means Y-shaped pricking object that is responding to pain, 3 means ear, so sound, so he responds to sound, and 4 means he responds spontaneously, so he opens his eyes spontaneously, is S. So now next is the verbal response. So after eyes, next would be the verbal response. Now the mnemonic for verbal response is no sound would come out. So this is a mnemonic because verbal means sound, so no sound coming out would be the mnemonic. N means no response. So this is also serially, so N is 1, S is 2, W is 3, C is 4, and O is 5. So N means no response, so it gets a score of 1. S means inappropriate, so S means inappropriate sound. So when the patient produces inappropriate sound, that is S, that is 2. W means inappropriate word. So if the patient produces inappropriate words, that is W, so it's a score of 3. C means he is confused, right? So he gets a score of 4. And O means he is oriented, right? So he gets a score of 5. So no sound would come out serially, 1, 2, 3, 4, 5 scoring, right? And at last we have the motor response, right? Now the mnemonic for motor response is very easy. The mnemonic for motor response is, we are just tweaking the word Netflix. So we are just tweaking the word Netflix and making it Netflop. So Netflop is the mnemonic, right? So Netflops, and ETFLOP, right? So N, so serially, so N means no response, so there is no response, so it gets a score of 1, right? For ET, it means abnormal extension. So abnormal extension, as we have already understood, that is the decerebrate, right? Cerebrate posture. So abnormal extension, ET means extension, so ET means extension, this is score 2. For F, which is flexion, we have 2 types of flexion. One is abnormal flexion, and next is normal flexion, right? Now abnormal flexion also means decorticate, as we have already understood, and A comes before N, right? So A comes before N, so it is getting a score of 3. So abnormal flexion is a score of 3, and N is after A, so N gets a score of 4. So normal flexion gets a score of 4. For L, we have localizes to pain. So if the patient localizes to pain, he gets a score of 5. So L is 5. And O is he obeys our command. So if he obeys our command, so he gets a score of 6. So P has nothing to do here. So N means no response, ET means abnormal extension, flexion is 2 types, abnormal and normal. So abnormal comes, A comes before N, so it is getting a score of 3, and normal is getting a score of 4. L means he localizes to pain, and O means he obeys our command, so 1 to 6. right? So this is the mnemonic for GCS scale. So for eyes we have eyes, for verbal we have no sound would come out, and for motor we have net flop, right? Thank you. So if you liked our content, please like and subscribe our channel, and I'll be posting more videos and more mnemonics on medical related topics, so stay tuned.